What is more common in the aortic valve, stenosis or regurgitation? And you have a great example there to look at and give us an idea.
Aortic stenosis in our population of patients that we see is more common than aortic regurgitation or leaking of the valve. Stenosis is when the valve becomes tighter and doesn't open fully. As you see in this valve, it's not opening completely. And that's the one we see much more common. It happens more commonly with age.
I know that we're seeing it only open just a little bit on that, but could you just look at the screen a little? And so would it be completely open then? If it was a normal heart, that valve would be opening twice the size that it is that we see on that animation?
Exactly. A normal valve opens about 2 square centimeters and would open completely. This valve is opening about halfway and indicates it's very tight, and it's opening about only 1 square centimeter. And that's a 50% decrease in the size of the valve as it gets to what we would call severe aortic stenosis.
Could you use, again, the graphic there and give us an idea of what a bicuspid aortic valve is and how that contributes to stenosis?
In a bicuspid valve, the leaflets are fused. 2 of the leaflets are fused together. The patient was born with the leaflets not being completely separated and opens only as 2 leaflets. So you might see this leaflet fused together and the other leaflet moving. So from birth, they will have a murmur. They're more likely to develop a leaking valve and much more likely to develop a stenotic valve, and can even develop an enlargement of the aorta as they age, which has to be watched carefully.